Did you know that 1.3 million deaths globally every year are due to antimicrobial resistance? I didn't know it either until I was prepping for my conversation today with Pam Cipriano, the current president of the International Council of Nurses. Pam represents ICN on a number of globally impactful initiatives and shares with us today some of the most recent outcomes of the UN General Assembly and the Summit of the Future. Pam is known both nationally and internationally as a strong advocate for quality, for growing nurses' influence on healthcare policy, and leading efforts to advance the role and visibility of nurses. She was Dean of the University of Virginia School of Nursing and served 2 terms as the president of the American Nurses Association. Pam was named among the top 100 most influential people in U.S. healthcare by Modern Healthcare magazine for 4 consecutive years and one of its top 25 women in healthcare in 2015. In other words, she's kind of a big deal. And I'm thrilled to have the opportunity to chat with her today about the work ICN is doing to address global health challenges and nursing workforce needs. So let's jump into it. Across global health systems, health workers on the front lines of care delivery are carrying more on their shoulders today than ever before. Workforce shortages are increasing, scope of practice is shifting, and skill sets are definitely evolving. In this podcast, we're setting the table for some powerful discussions with nurses, allied health professionals, regulators, tech innovators, and other thought leaders across the globe. Together, we're diving deep on the challenges and opportunities that loom large for recruiting, training, and equipping the health worker of the future. Welcome to Care Anywhere, the Global Health Workforce Podcast, brought to you by CGFNS International. Hi, everybody. Welcome back to the podcast. I'm so excited to welcome our guest today, Pam Cipriano with the International Council of Nurses. Pam, welcome to the podcast. So glad to have you here.
Hi, Lea. Certainly glad to be with you.
So let's start out. Tell us a little bit about yourself for our audience who may not know you, your background, and maybe a little bit about the nature of the work you do with ICN.
I have been a nurse for over 45 years, and I have loved just about every minute of it. It has been a wonderful career experience, and I've been in just about every conceivable role, starting as a staff nurse, obviously, to then moving into a clinical nurse specialist role, nurse manager, nursing director, nursing executive, also in the hospital executive suite, chief operating officer. And that's always been one big piece of my life is clinical care and operations management. But I've also had a parallel track of leadership in nursing associations, beginning with when I was president of the National Student Nurses Association, which was really a life-changing experience, allowed me to meet the pioneers in nursing when I was a student and really got me hooked on organization work. So throughout my career, I have always been involved. I've had numerous roles in the American Nurses Association in many of our states, culminating with serving in 2 terms as president of the American Nurses Association, which was an incredible experience. While I was on the ANA board, I became introduced to the International Council of Nurses because ANA is their member. And as when I was president, before I finished that term, I ran for election to the board of the International Council of Nurses. And so I completed a 4-year term serving as the first vice president and then went on to win election as the president. I'm in year 3 of my 4-year term, which will end next June when we have our phenomenal Congress in Helsinki, Finland. The work that ICN does is to really have, again, sort of a twofold approach. One is we are the voice of over 28 million nurses worldwide, and we advocate for advancement in the nursing profession globally. At the same time, we advocate and work toward strategies and policies that will create health for all, that address the crises in the world, the global health challenges through policy development, through work with our members, through programs that do everything from leadership development to help nurses who are in places of war and disaster. So we have a broad agenda, but it's really focused on improving nursing so that we can improve the lives of people everywhere and deliver on health for all.
That's excellent. I love hearing that you came up through associations. We could probably have a whole nother podcast episode on just the value of professional development through associations. I grew up on the health information management side of healthcare, but I couldn't say enough good things about my association engagement and what it does to position us not only in our careers but to give us a voice at the
Yeah.
table. So I appreciate you sharing that for sure.
And
One of the
Leah, can I
sure,
share one
jump
quick
in.
thing? I
Absolutely.
always forget, having spent so much of my time in professional activities, I always forget to say I'm very fortunate. I have a wonderful husband. I have two adult daughters. And the reason I think it's important to add that is that people will often ask me, how have you been able to do all these things that you've done, all
Right.
these groups, all these elected offices and things. And it is not only about balance, but it's also having support, and it's being able to again, have those around you that support what you're doing. And I always encourage everyone to make sure that they look for that as they establish their relationships in life.
Oh, I appreciate that. Love the shout out to family and those that support us along the way. So that's great. Appreciate that. One of the themes of our podcast, Care Anywhere podcast, is really talking to health professionals about career trajectories and all of the opportunities for those in nursing and allied health, to advance their careers beyond and outside of traditional bedside or frontline care, which your career has certainly taken you through a number of roles. What inspired you to become a nurse? We asked that question of everybody. What was there something that sparked your interest, and how did you get started in the profession?
Well, my start was a little non-traditional. I had gone to a college of not too far away from home, but in a very rural part of Pennsylvania. I was living in the Philadelphia suburbs. And for 2 years, I was in a medical technologist major. So I had lots of science, lots of biology, chemistry, all those kinds of things. But I really didn't like where I was going to school, and I thought, oh, I need to switch and I need to find some kind of career where I can use all these sciences. And I think I had realized too that I really liked interacting with people, probably wouldn't want to be in a laboratory. So I then looked to nursing. And with no one in my extended family having anything to do with healthcare or nursing, it was interesting because my grandmother, who lived with us at the time, said, "Why do you want to go take care of all those old people?" She was 80 at that time. But I was very excited to learn about nursing. Had a good friend of my mother's family whose daughter taught at the school that I ended up going to. But it was something that I think really offered lots of opportunity. Again, was science based, and I thought that was really critical. And so it allowed me to get back closer to home and be able to have an excellent education.
That's great. I love about nursing, similarly to education, that people feel it's both a vocation and an avocation. So it's a job and a calling in a lot of ways. We hear nurses and healthcare workers saying, "This is what I was meant to do, to take care of people and to serve." So I'm always excited to hear about how people are inspired to get into the profession. So, but let's pivot. Let's talk about the great work that you're doing at ICN, the initiatives that you guys are advancing around nursing workforce development globally. You are fresh off the UN General Assembly and the Summit of the Future, which I think was just last month in New York. The Pact of the Future
Yeah.
was one of the outcomes of that event, adopted by the UNGA, as well as the Global Digital Compact and something called the Declaration on Future Generations. Can you share with our audience what those three outcomes mean and the objectives of those and what they hope to accomplish?
Yes, definitely. The UN General Assembly is quite an experience. It's very high-powered, political, lots of things going on, lots of negotiation and bartering between countries in terms of what they're willing to support or not support, and again, a lot of official representation. There are also other events that occur around that, which gives those of us that are not state actors, meaning country representatives, to participate in other activities. But this year's culmination of the work of more than the last year, the Summit of the Future, was really intended to set the stage for about the next decade. It may not span that many years, but be able to say, there are ways that we need to protect the people of the world, that we need to come together to address peace and security, that we need to recognize there are many threats that together we must face because we are all in this world together. We know that there are no boundaries that stop diseases, no boundaries that stop hostilities, no boundaries that stop some of the climate change events. So coming together at the United Nations is a time to really say, what do we need to do together to protect one another as well as protect ourselves? So Summit of the Future created the Pact for the Future, which again is a multilateral agreement to say we believe it's important to identify where we need to do better and where we need to invest. So it is many, many recommendations. Two of the areas, though, that received significant attention were investing in youth and bringing the voice of youth to world policy. So that's one area where the United Nations has tried to do much more to say the youth are our future. We cannot discount their voices. They have ideas, they have solutions, and we need to be sure that all of our organizations are embracing the voice of youth. The second was climate change effects and recognizing that we must all invest. We have to be stronger with one another to say it is time to that everyone takes seriously their role in reducing carbon emissions. It's also a time to be able to say, if one part of the world doesn't do their part, it affects others. And we also know with climate change that those who are underserved populations, those who are in the poorest areas, contribute the least to the pollution and climate change effects, but have the lion's share of the detrimental effects.
Right.
So those are two key areas in the Pact for the Future. And then there are many global issues, again, that really focus on peace and prosperity, as well as recognizing that together we must address any threats. The other high-level meeting that occurred that doesn't necessarily pop out at you is on antimicrobial resistance. So that was another political declaration, and that's the terminology the UN uses, to come together to recognize that we have human, animal, and plant use of antibiotics in the world. And that's looking at what's called the One Health concept, to
Right.
recognize that we have to use antibiotics appropriately. We have to make sure, as we look at human use, that there's not overprescribing, there's not faulty prescribing, that people aren't taking antibiotic use into their own hands, and which doesn't follow the prescribed rules of the science of using medications, and at the same time recognize that there is this system that works together. Again, animal antibiotics, plant and other agricultural antibiotics, because it's all connected, whether it's our food supply, whether it's our the air that we breathe, that it is all together. But we do have a serious responsibility in terms of, as being health professionals, to make sure that we're doing all we can to have stewardship of antimicrobials. Because one of the shocking numbers that I just learned recently was that the number of deaths in African countries from antimicrobial resistance, which usually leads to sepsis, and just a number, again, many deaths, is higher than today's count of deaths from malaria and HIV combined.
Wow.
That should
That's
scare all of
frightening.
us
It
in
should.
recognizing that we have a responsibility.
Yeah.
So those were the high-level meetings in the Pact for the Future. The other two documents that were codified and agreed to were first the Global Digital Compact. Now, the compact has been out for a while, so this was an opportunity again for formal approval of that document. We know that the world is changing because of technology. We want to make sure that technology is used for good and not for bad. We want to make sure that the newest inventions, such as all of the use of generative artificial intelligence, as well as looking at many aspects of automation, again, are really focused on how can they help us. That also means looking toward digital literacy for everyone, not just the people who can afford it, but everyone in our communities. It also means making digital technologies available.
Right.
In some of our poorest countries, it's actually fascinating that everybody has a cell phone, but those cell phones are lifelines. And so having countries identify how can they best contribute to the digital literacy for their people, the implementation of technologies for everything. That's personal e-commerce, as well as just being able to communicate, improve productivity in our work, in our industries, as well as then recognize that it's an essential part of our communications worldwide. So the Global Digital Compact is everything from resources from the top down and to the bottom up of saying we want to make sure that together we are prepared and adequately using technology that really helps human life as well as advancement in all countries.
Yeah.
The Declaration on Future Generations really picks up on that theme about supporting youth. It's recognizing that we need to keep children healthy. That's everything from their food supply, their ability to get vaccinations and health care, to their ongoing education. And so it is a commitment to recognizing that we must take care of our future generations. I mean, and none of these things should be controversial, but of
Right.
course, there are specific aspects that get a lot of attention and get a lot of discussion. And most of the agreements that come in the United Nations take years to fully implement. But again, set a standard and really talk about the collaboration and engagement that's necessary to achieve them. Yeah, and Leah, you probably know this, but maybe some of our listeners don't. There are two digital divides. There's the digital divide of those who have resources and those who don't. But there is also a gender digital divide. And so gender equality is a very important part of addressing this divide within technology. Women are less likely to have technology at their disposal. Men are more likely in both poor and wealthy countries to be using technology. And so we need to make sure that we even that playing field, because women, again, really are producers for their economy, and they
Right.
can be enabled and strengthened through the use of technology.
Absolutely. So while at the summit, the World Health Professions Alliance, WHPA, which ICN is a member of and you represent, I think, at this event, called on world leaders to urgently increase investment in health workforce in order to fulfill the commitments that were outlined in the Pact of the Future that you just mentioned. What kind of investment needs to be made, and by governments, and then also by health systems and organizations and employers who manage these workforce issues? So, can you talk to those investments that are being called for?
Absolutely. Yeah,
Yeah.
the word investment has been front and center in the International Council of Nurses platforms in the last year and a half in particular. We always are talking about
Yes.
needing to support our workforce, needing to be able to have the production of nurses that we need to have good health care. But starting last year, the International Nurses Day theme, which is celebrated May 12th every year, Florence Nightingale's birthday,
Yeah.
focused on our Charter for Change and really sending the message that we have to invest in nursing. The message is that we have to value, protect, respect, and invest in nursing. Why? I think everyone knows that the healthcare workforce, including nurses, was decimated during the pandemic.
Right.
We saw 20 to 25% of our workforce leave, particularly hospital employment, and that was worldwide. We also saw a lot of small countries who don't pay their nurses well and don't have good working conditions leave to go to higher income countries for a better life, for a better job. So there's been
Right.
significant disruption in the global workforce. At the same time, before the pandemic, we had a projection of a shortage of 6 million nurses globally, with about half of those in African countries. And there's a couple reasons for that. Some is a lack of jobs and some is a lack of nurses. But if we're not calling for investment in the nursing workforce, we will continue to not be able to deliver on health for the people that we serve. So we've been talking and again, passing policy actions and working with our World Health Professions Alliance colleagues whose professions also suffer the same issues. And this is medicine, dentistry, physical therapy, and nursing. Again, together, really looking at the fact that we all need to boost our workforce numbers. And the investment part is kind of tricky because as we talk with health ministers and finance ministers around the world, what they will tell us is they have no new money to invest. They may believe it's important to improve their budgets for healthcare. So one of the other clear avenues of action that was called for at the UN meetings this year is the uh, changes in the international health financing. What we've learned, particularly over the last couple of years, as we've been asking for greater investment, is so many countries are handicapped with their international debt. So their debt burden for countries that are poor, they're spending more repaying debt than they are paying for health care for the people they serve. That's a really sorry state of affairs. So, of course, even if they want to listen to our requests and our suggestions for how to realign or redesignate funding for healthcare and boosting the workforce, they are handicapped by this huge debt. So there's a huge call to look at how we can restructure international financing. So we do have conversations with the World Bank, the World Economic Forum, with other constituencies, including our government, to look at how can we help bring this conversation forward. The United Nations is a very strong player in terms of trying to address these issues.
Right.
And so it's really important. But the World Health Professions Alliance again, really has continued its call for greater investment, but recognizing, let's work together to figure out how can we also help with the organizations that we interact with to get this international financing problem solved.
Well, and funding's just one side of the issue, right? Because there's other investments that I know you guys are calling for employers and health systems to make. In your Recover to Rebuild report, I saw that there are
Yeah,
quite a few areas where impact assessments are being recommended at multiple levels for health systems and governments to really look at what are the impacts of shortage on nursing burnout and overload and patient ratios and nurse safety. So I didn't know if you wanted to speak to that, but I think you have to know a problem or be leaned in on assessing it and figuring out what the problem is to be able to find the right solutions for it.
absolutely. So if you ask the nurse what's the number one pressing problem or challenge that they have in their organization, they can tell you it's staffing. And many organization leaders will say their biggest problem is workforce or staffing.
Right,
At the same time, we're seeing behaviors that are inconsistent because workforces are being cut.
yeah,
And of course, we've said repeatedly that is not the way to solve the problem
right.
of
You make it
financial
worse.
challenges.
Yes,
And I think it's interesting, obviously, one of the things you said, which is very true, is what is our impact measurement? So we do look, particularly in the high income countries, we'll look at turnover, we will look at retention, we will look at are we entering a slippery slope of not being able to attract new entrants to nursing? Because
right,
we've seen this historically as a pattern. So we need to be really careful we're not slipping back into that. But we also know, and ICN has called for countries to create workforce plans for each segment of their health workforce and fund those plans. Now, what has really come to light more recently is that we have a measure that says if you're going to deliver health for all, if you're going to work on Sustainable Development Goal 3, and particularly 3.8, which is universal health coverage, which in our parlance in the U.S. is we need to have people receive their essential health benefits.
right,
But we also know that there's many people who don't get access to services. But we know that there's a certain density of number of nurses per 10,000 population. And so that's another way that countries can look at do they have enough nurses? Now, the US actually meets that number,
yeah,
but we know that the nurses are not in all the places where they are needed to deliver care. So that's why we are also really focused on saying we must improve the work environment. We must pay attention to nurses' health, well-being, and mental health, because those are the
right.
kinds of things that will attract and keep nurses in our workforce, keep them healthy so they can be their best. So measures can be at the national level, at the global level. We have again sheer workforce numbers, but barometers to tell us whether we will be capable of delivering on health for all. And at the same time, our healthcare organizations have a big responsibility to make sure their workforce is being cared for, and that they're not making precipitous decisions to reduce numbers that take away the essential resources or reduce the amount of nursing care that's being delivered because nurses are the preventers of bad things happening. I mean, they are the problem solvers. They're keeping people safe.
Absolutely.
They are making sure that no matter what setting they're in, they're looking at care in the community. They're looking at prevention. They're looking at making sure people don't develop or have complications from chronic diseases. Again, a nurse is so essential in every place that we care for our communities.
Yeah. Well, you mentioned there, which was a great segue into the next topic, universal health coverage. Certainly a little bit controversial here, but globally, um, a critical goal, I think. ICN is tackling that, and that's a particular passion and focus for you, I know. So let's talk about that a bit. For those that aren't familiar, the United Nations is advancing 17 sustainable development goals, one of which is good health and well-being. And under that goal is goal 3.8. And I'll quote it so for those that aren't familiar: achieving universal health coverage, including financial risk protection, access to quality essential healthcare services, and access to safe, effective, quality, and affordable essential medicines and vaccine for all. That is an ambitious goal, but certainly a noble one. So, can you talk about the work you're engaged in to advance that goal, where you're seeing progress in areas of the world as well as where the challenges still are? Because I imagine it's a pretty steep climb uphill.
I'm fortunate to be serving right now as co-chair of the UHC 2030 steering committee. So 2030 is the goal for achieving all of the sustainable development goals for the United Nations.
Yep.
The pandemic clearly put us back on just about every single goal. But UHC 2030 is a multi-stakeholder platform to really encourage and advocate for achieving the goals. And of course, for us, because we're focused on health, one of the key areas that we're looking at is what are all the ingredients that going in to be able to meet universal health coverage. And again, it's not necessarily the words we hear in the US. We talk about access to services. And if you think back to the Affordable Care Act, we did include 12 essential healthcare services that
Right.
really covered the range of things we're talking about in universal health coverage. Everything from early birth experiences to end of life and palliative care and everything in between. And as you mentioned, Leah, one of the other key pillars is that people are not pushed into financial hardship. We know that's an issue in the United States. No matter that we've tried to improve that situation, try to have subsidies for insurance, try to have
Right.
programs that will fund those that don't have means. It is a big problem around the world. Again, remembering that many, many other countries, it is their government that funds all their health system. So ours is a little bit more complicated. But the work that we've been doing and that we again have great metrics around the world. And if we talk about access to services, most countries have seen improvement. They really have. And they've been working hard at that, the U.S. included. The U.S. is one of the best prepared in terms of providing that care. However, one of the interesting things that we've also seen in the last couple years is as countries have boosted their services, guess what also went up? The number of people who are experiencing debt from healthcare and who are in fact being pushed to poverty.
You don't
So
hear that talked about nearly enough.
no, we don't. We don't.
Yep.
But that's the double-edged sword in
Yep.
terms of being able to see greater services. But again, globally, this issue of financial protection has really bubbled up to say, where are we falling down in terms of really achieving all the principles of universal health coverage? And it is, how do we get the financial protections in place? So that's why we're focusing on saying together, let's bring our stakeholders into this discussion to work even more aggressively to say, let's help our countries have the leverage with their debt burden so that they can invest more in their healthcare. Let's look at how healthcare organizations can identify ways to streamline care, to improve the delivery so that people are not, again, pushed into poverty. And also look at, is the delivery of care efficient? How can we use technology so that we're actually cutting down on the cost of care? How can we make sure that we're getting services to people upstream from developing their problems, upstream from developing chronic conditions that send people to the hospital or create more and more health issues? Again, if someone could be prevented from going into renal failure or from developing hypertension or the complications of diabetes. Just think how much better off their life would be, as well as the impact on the health system. So the focus on non-communicable diseases is critical in this discussion, as well as looking at how countries and their governments can really help ease the financial burden. And again, healthcare providers know all of this, want to be integral to making sure that it is better, and that we are all playing a key role. And that's why the policy discussions are critically important, and that's why we're seeking to have greater influence. So ICN is very pleased that, again, I have this opportunity to help lead the UHC 2030 movement, but also work closely with all of our members that are doing the same thing. And one of the things we're stressing is we've just put out a publication on the role of primary nurses in primary care.
Just
The
about to ask you
path,
about that.
yeah, the
Yeah.
path to UHC is we have to boost primary care.
Yeah. Yeah. Oh, and that's an interesting focus because some people might think, oh, you have to address the cost of acute care, and obviously it's a big expense, but the focus for, as you had shared with me, with universal health coverage is really advocating first and foremost for access to primary care. Can you talk about why that's the best approach? I think you touched on it a minute ago, and really in terms of preventing acute care episodes. And then also, how does this present an opportunity for advanced practice nurses? Because I think there's a connection there that you had mentioned in our prep call. So I'd love for you to touch on that.
Yeah, having been in healthcare for a long time now, I can remember many years ago where as we were having these discussions about, how do we improve healthcare? We said, oh, we need to shift care out of the hospital.
Yeah.
We really need to focus on primary prevention, and we're only going to do that through primary healthcare and our public health systems.
Right.
Well, guess what? 10, 20, 30 years later, we haven't done that. And so it is a little bit of deja vu
Yeah.
where globally now we're saying the path to universal health coverage, keeping people healthy, is through primary health care. And the U.S. has been very reluctant to move in that direction, even though we've had starts and stops to say we need to fund the production of more physicians who work in primary care. And part of the solution to not having enough physicians in primary health care has been the growth of nurse practitioners.
Yeah.
And so in the U.S., we recognize that trying to reach more people, trying to place the emphasis on preventive care is critical in that primary healthcare arena. And advanced practice nurses, whether they are nurse practitioners, clinical nurse specialists, certified nurse midwives, and in many cases are certified registered nurse anesthetists, are key providers in that space. And it's not obvious sometimes as to why we need to make this switch. But let me just share with you a couple issues again that I've learned through my global work.
Absolutely.
We all just survived. Well, unfortunately, not everybody survived. We all just went through the pandemic. This is part of what's called health security, is being able to have the prevention, be able to have a response. And you can't do that if you're not providing early detection of problems. Where's that early detection occur? In primary healthcare settings.
Yeah.
Antimicrobial resistance that we talked about, if we can educate our patients in those primary care settings, make them knowledgeable about what the right course of care is, that's fantastic. Vaccinations. We've seen the resurgence of diseases we had eliminated because we're not really getting to our families about the importance of early childhood vaccination in ways that we can deal with the misinformation, the bad information, the myths, and be able to restore integrity to our immunization systems. We also know, again, as I mentioned with these non-communicable diseases, that if we really were interested in keeping people healthy and saying, let's look at your ability to access good food, clean water, clean air, have healthy habits. Just think about the number of diseases we could prevent that have chronic implications. Now, we can't prevent all of them. We know there's genetic disposition. We know there's cancer. But some of the highest incident diseases can be identified much further upstream if everyone had access to a primary health care provider.
Yeah.
So we see so many reasons to recognize and figure out the delivery model that's necessary to keep people safe and again, really focus on prevention, primary health, and public health. We tended to take our funding away from our public health systems, which is why we had such a slow response in some ways to the pandemic.
Yeah.
But we also know that nurse practitioners, and again, I also say all advanced practice nurses, are playing critical roles. This is a great trend that we're seeing around the world. And I would say there's even greater collegiality in a number of other countries where they just don't have as many providers, and so the advanced practice teams are able to really share their knowledge, be able to serve more individuals, bring those services forward, whether it's in the rehabilitation aspect of life, whether it's cardiac rehabilitation or other physical rehabilitation, whether it's in treating diabetes and its other problems, looking at heart disease as like one of the number one killers around the world. And so advanced practice nurses, fortunately, are increasing in number. Many more countries around the world are creating the educational pathways for advanced practice, as well as specialization at the general practice level. So this is a really important development and recognition that nurses are critical in providing primary health care for universal health
And
coverage.
it really, despite everything we hear about shortage and burnout and turnover and all of that is certainly significant and a challenge. It's a great time to enter the profession. It's a great time to become a nurse for all of the reasons you just stated. Increasing scope of practice, share of voice, influence over care model evolution, and just so much career opportunity that maybe wasn't available to nurses 20 years ago. So let's talk about the nurse workforce, which is a great segue into the next question. How, when we look at nursing today and the future of nursing, how is nursing education keeping up with these global challenges that we've talked about, as well as advances in care, emerging technologies, which we touched on briefly, and then the need for more specialized knowledge. Can you touch on that workforce development piece in terms of training and education?
We're seeing some great advances worldwide, which is really exciting. Again, not only are we seeing other countries create graduate level programs from master's to doctoral level, some are actually looking at implementing doctor of nursing practice programs following the example from the US. Recognizing that we need to have that scholarship, we need to be able to have the research and evidence-based practice that allows the very best care to be given and put that information, knowledge in the hands of nurses. Now, some countries that are not that far along, but really again recognize that nurses have had a boom in the amount of knowledge they need to assimilate to be able to provide care. Many countries have moved towards providing specialty knowledge. And so we're in the US, we're very accustomed to that. We have many, many specialty certification examinations. We have done most of that specialization on the job through additional courses, through some of our professional associations that are specialty organizations. But really, again, focusing on saying if we have specialized knowledge and you aggregate that patient population, you're able to concentrate the knowledge that's needed to know the latest updates in care, to be having, nurses with that expertise really be able to identify, what's most important in terms of looking for changes in that patient population or
Right.
being sensitive to understanding everything from the impact of medications to services that are needed at home as well as in the acute care arena. What we also know is that technology is playing a huge role. Most nursing schools are doing an amazing job, I believe, in keeping up with simulation technology, everything from the most basic to augmented reality, virtual reality, because we know it's really important to make sure that that expertise is in our schools. And as we have seen shortages of nursing faculty for some time, there is the ability to use simulation to augment the teaching. And so I think
That's
that's been a
certainly one of
big
the things
boost.
that came out of COVID, right?
Yeah,
The
and
pandemic.
students love it. And
Yeah.
they really do. Well, so what we really I believe our schools are again doing a great job. The standards for education are being upgraded consistently. Right now, you're probably aware that the American Association of Colleges of Nursing has put forward its competency-based standards. And so that is a shift that we're seeing globally, not just in nursing, but in medicine, to have competency-based education. So
Right.
those essentials will be important that as we look forward to say how do we really know people have learned what they need to demonstrate and practice.
Yeah.
So we're seeing a number of ongoing changes, the need to validate that education and skill through
Right.
certification, through badges, through other ways, and the ongoing professional development, fortunately, is something that nurses embrace everywhere. I think it is part of our DNA to be lifelong learners, to
It
want
is.
to
Yeah.
improve what we're doing
Yeah.
and to help each other. So we do see that across the spectrum, but it's a wonderful time because again, it allows nurses to be greater contributors as we have a lot of team-based care. It gives us the opportunity to showcase the really critical role that nurses played. And we're not just following orders. We are not just, you know, putting orders into place to say this is what I've been told I need to do, but really being the generators of changes in practice,
Right.
recognizing when we need to shift gears in response to how a patient and or family is presenting. And part of the way that nurses are able to keep up is through that professional development.
That's great. Pam, this has been such a great conversation. I wish we could keep it going. We're nearing the end of our time. Um, I'd love for you to just end us by offering some advice, if you have any, to nurses who are entering the profession today around the globe. What advice do you have to those who are seeking a profession in nursing about the direction of the future and what they should be thinking about and preparing for?
I would always encourage an individual to become a nurse. I think the only change in our discussion today is who are we talking to and who are our targets?
Right.
Because one of the so we know that we're ignoring two major parts of our population in general. This is not true in every country, but we know that for much of the world, 51% of the population is female. But what about that other 49%? where globally we only have 10% of nurses who are men.
Right.
We need to be actively encouraging men to come into nursing, whatever their backgrounds are, and recognizing that we are a gendered profession and we want to see that shift.
Yeah.
The other major population that I believe is very interested and very ripe for recruitment is older adults. By older, I don't mean, retirement age. I mean
Right.
those who are perhaps second career,
Second
or
career
those who,
husband.
who are unaware that they can make a shift.
Yeah.
We have great examples of nurses in their late 30s and 40s and even 50s who have discovered nursing. One of the stories I like to tell is there are two National Football League players who have entered nursing school just in the last 2 years. And what a great example. They're both men, obviously.
Yeah.
So it's like a double benefit. Also, one of the former ministers of education in Denmark is a nursing student now. And so we have great examples that we need to make sure we're not ignoring wonderful segments of the world's population. But at the same time, we welcome everyone. And while we recognize the traditional entrance to nurse has been younger women, that it's still a fabulous career because it gives you flexibility. You can come and go if you have other life events, which often happens in many countries. We know that globally there are certain gender expectations and pressures that again are the reason that so many nurses are women. There are some countries too where the high percentage of men is based on the beliefs of religion and culture in terms of who can care for men and women in their society. But as you well know, nursing offers so many opportunities to everyone. And our goal through the International Council of Nurses, through all of our nursing associations around the world, is to make sure that we continue to strengthen the nursing workforce, the supports for that nursing workforce. Again, value, protect, respect, and invest, because nurses are critical. We cannot afford to operate our health systems without nurses. We would collapse. So we want to preserve and grow that nursing workforce for the future.
That's a beautiful way to end this episode. Thank you so much, Pam, for taking your time with us today to share with our audience your experience, the work that ICN is doing on such critical global issues. Thank you for the work that you're doing on behalf of all of us to advance those issues. And it was such a pleasure to have you today.
Thank you, Leah. I've really enjoyed our time to speak together, and I hope we encourage some new individuals to think about nursing too.
Absolutely. All right, guys, that wraps up this episode of Care Anywhere, the Global Health Workforce Podcast brought to you by CGFNS. If you've missed any of our episodes, you can find them on our website. Tune in next time, and thanks for being here. That's it for this episode of Care Anywhere. Thanks for joining us. We hope you'll tune in for future episodes where we will continue these powerful discussions about our global health workforce. If you missed any episodes, you can find them at cgfns.org/podcast or by subscribing to our channel on your favorite podcast platform. Just look for our podcast logo or search for Care Anywhere to find us. Thanks again, and we'll see you next time.